We are delighted to be here talking about doulas. Joining me on stage, and they will each give them an overview of themselves and their organizations in just a bit, but we've got a wonderful panel of experts in this field, all sharing different perspectives on doula and the value of doulas in maternal health. We've got Deborah, Randa, Latasha, and Neil, and we'll get to some more in-depth intros in just a minute. But as we all were just sharing some stories on the side, we were also saying how remarkable and impressive it is that of all the things that Leapfrog could be having a plenary panel discussion about, that they chose maternal health and specifically doulas. So thank you. It speaks to the growing awareness of the challenges in patient safety related to maternal health and also the crucial role that doulas play in this space. So I wanted to set the stage first with sharing a few slides of some information from Leapfrog's hospital survey in which they collect data on maternal health care outcomes and how hospitals are performing in those areas. You can see here on the slide anything from C-section rates to episiotomies to screening for jaundice, blood clots in C-section surgeries. And then they also look at services that are provided to birthing people. And you can see here a number of things there, having nurse wives available, lactation support, and importantly, doula services. And if you are a hospital who has completed one of the surveys, you can see what the results look like. So definitely encourage you all to take a look at Leapfrog's survey in particular related to maternal and doula services. It's an area that we are all very focused on, and I think you will see a lot of your patients increasingly being asking about your services and capabilities in those areas as well. All right. So with that, I would like each of my panelists here just to take a few minutes to introduce themselves and their organizations to the audience. And I'll start maybe with you, Deborah.
Thank you. It's very nice to be here with all of you today. I am the founder and the CEO of the Institute for Perinatal Quality Improvement, and I'm a longtime advocate for improving perinatal health care and eliminating perinatal disparities. I also am a co-editor of the book that is the giveaway for the social media. My son died due to disinvestment in infrastructure just a few years ago, and he wrote this book that was under peer review at the time of his death. It's about how we stop blaming individuals for bad outcomes, so it's very relevant to the meeting here today and social determinants of health, and it's a pleasure to be here with everybody on the panel.
Great, and Randa.
Thank you. And sorry about that, Deborah, I didn't know that. My name's Randa Deaton. I'm the Vice President of Purchaser Engagement at the Purchaser Business Group on Health, formerly Pacific Business Group on Health. And we are a national nonprofit organization comprised of 40 of the largest businesses and public purchasers. They spend about $340 billion on healthcare every year, representing 21 million Americans. Our goals are to work with them to be more effective purchasers, to advance quality, affordability, and health equity. And one of our key strategies has been to drive improvements to maternal health and birth equity, and we'll talk more about that today.
Wonderful. Latasha.
I'm Latasha Rouse, and I am a doula and owner of Birth Sisters Doula Services. And I started out this whole journey of becoming a doula from having triplets at 26 weeks, 6 days. They are 11 years old now, and the information I learned about the healthcare system after sharing my story and working on several committees around the state and around the country on improvement, and then filling those gaps became very important. So I became a doula to do that. I've served over 100 births in the last 6 years, and I see the difference that it makes as far as hearing those gaps and being able to fill them, the social determinants, the information that people need, and the confidence they have going into their birthing situation. Glad to be here.
And Neil.
Hi, everybody. I'm Neil Shah. First, I want to also amplify and echo Ellen's comments about the focus of this panel today. It is, I think, a watershed moment in the overall effort to improve maternal health that Leapfrog is platforming this issue and talking about doulas specifically. I think that most of America still doesn't know what a doula is, but Leah was reminding me that several years ago we were chatting at some meeting, and she was like, what is the one thing that you would do to improve maternal health. And apparently I said funding doulas, and apparently that was a good take. So here we are. So I'm an obstetrician. I consider Penny Simpian, who started the modern doula movement, to be a very close colleague. She just passed away last year, but we did a lot of work and research together when I was a professor. And right now, I'm the chief medical officer of Maven Clinic, which I think now is the world's largest virtual clinic for women's and family health. We work with purchasers, including a lot of the membership of Ellen and Randa, everyone from Amazon, Microsoft, Google, to the AFL-CIO and many Medicaid plans. We have over 2,000 clients, 17 million lives, and I think we're in 175 countries at this point, so a lot of scale. And the way that we support our members through purchasers is by giving them 24/7 access to virtual care and services, including doulas. So I'm excited to get into how we're doing that and some of the evidence behind it.
All right, well, and Neil, you just said probably half of America doesn't know what a doula is and what a doula does. So Latasha, what does a doula do?
So, classic definition of a doula is a trained professional who is there to support the birthing person and their families with information, with physical support of being able to show them how to do things, and then also with making sure that they have the ability to navigate their system, those kinds of things. So we're looking at being able to be there throughout the whole process. You're starting in prenatal, you're there for their labor, and you're there in the postpartum period. So that entire process, you have someone that's able to fill in those gaps. I heard this conversation earlier from Colonel Coffey, and I heard, you need a doula. That's what I kept hearing. Where do I go? What questions do I ask? Where's the best place to go? It's different depending on what your needs are, being able to find that information in the community. And then also, doulas help to improve outcomes as far as moving people and helping them move and navigate in the space when they're in labor. That helps to reduce C-section rates, making sure that people have the information that they need. So doulas are, that go-between, that holistic approach to maternal care that makes care better.
I think a lot of kind of the myths and misnomers around doula services that I think most people think of doulas at the point of birth. And you just said that doulas are involved soup to nuts, from pre-pregnancy, early phases of pregnancy, to birth and after birth.
Correct.
Can you speak, and feel free, any of you, to speak to how doulas engage throughout and post-pregnancy, and how are they specifically supporting the birthing person throughout that journey? Anything more you'd like to elaborate on?
Sure. So post-pregnancy, what you're doing is you're going to check in on healing. You're finding out those warning signs that you know about, the postpartum warning signs. You're checking in on those. You're checking in on mental health. You want to know how are they doing after having this experience and what their support system looks like. You plan for that in the prenatal, but then in the postpartum, you want to see it actually work. Has that unit come together, and is that support adequate? You're also looking at baby care. What needs do you have with feeding? What needs do you have with sleep? What are you able to get to your appointments? How are those going? Are your questions being answered? Do you have other concerns that have come up, other supports that are needed?
Great. Anybody else want to chime in on?
I have a very zoomed out take on the gap, just to give everyone some intuition, including folks who may be distant from when they had their kids or distant from when they themselves were born. I mean, we're all born. But right now, 99% of Americans, when they're giving birth, they go to hospitals. 25% of all hospitalizations are a mom or a baby. And just the cost of that alone is 0.6% of our whole GDP. So if you were to take our whole GDP, spread it around across the stage, you can see the cost of hospitalizing moms and babies. The reason it's so expensive is because everyone who goes into a hospital gives birth in an environment that is functionally an intensive care unit. Right, the definition of an ICU is not the presence of a ventilator, it's the ability to staff one nurse to one patient. And the only difference between the cardiac ICU and the labor floor is that the labor floor actually has operating rooms attached. So it's the most intense treatment area of the whole hospital for the healthiest people. And if you think about what everyone who's pregnant or giving birth or postpartum needs and deserves, it's probably like care, support, monitoring, coaching, all the things that Latasha just described. And then many people also benefit from modern medicine. And then some people benefit from surgeons. But we've designed the system backwards, where everyone gets the ICU and everyone gets the surgeon. Despite that, the outcomes are quite poor. And until relatively recently, we weren't having conversations about how we provide the care and support. And functionally, that's what doulas are experts in doing, in a way that surgeons like me are not.
Yeah,
Go ahead.
I'll add the importance of supportive team, underscore that whole point. And when I say team, that includes the family, that includes industry, that includes administrators, it includes the nurses. I am a nurse and took care of people at the bedside as well. And then having the doulas, but having this supportive care team really matters, especially when you're approaching for the first time an experience that you hear a lot about, that people have quite a bit of fear around. Having a knowledgeable support team that's really there for you and help you feel confident in your own body's natural abilities to give birth is very critical. And I would also, so I think a supportive care team, I also think another critical component of improving maternity care in the United States, and it's very related to that, is an approach, a mindset of physiologic humility. Be in awe of our bodies, the bodies that have made this baby and then are going to birth the baby. And I think doulas bring that sensitivity, that mindset shift, and this important aspect of this is not just another day in a person's life. This is a very important moment. And then I think related to that, there's data that tell us, and I think we need more data around access, and I really underscore the focus that Leapfrog does on having data to help us guide improvements in care, and doing that from looking at inequities. And I know many of you are struggling in that we haven't had systems set up in hospitals about tracking our data by race, ethnicity. Because in the end, the vision I have for our country is that we become the safest and most supportive place where people give birth and raise their children. And right now, that's not what's happening. That's not what's happening. And that's something we all have a responsibility to make different. And that's why you're here, so. Yeah.
Were you going to chime in?
Yeah, I'll just chime in to say, and even zooming back even further, just to say that, I think everyone knows that our country spends more on healthcare than, any other country in the world. We have among the worst outcomes. But when you zoom into maternity care for birthing people, we see, worse outcomes significantly compared to comparable countries, and we see egregious disparities. So when you think about, women of color dying at 3 to 4 times the rate of white women, that is a problem that is a systemic issue that has to be resolved. But let's be clear, it is not safe for anyone in this country to give birth. I think the outcomes are pretty stark. And one of the things that I think the business community, why at least our group prioritized maternal health and birth equity, is to say, how do we ensure that we're buying care that, is effective and safe and high quality and equitable? And doulas are a huge part of how they are beginning to provide coverage for doulas to really help close some of those gaps and help support people through their birthing journey. So I just wanted to say that, this is why businesses are really invested in maternal health.
Why don't we share with the audience more specifically what your group is doing in particular around this area?
Yeah. So PBGH set forth 5 strategic priorities, with maternal health and birth equity being the top of them, our strategy committee and our board. So we've had, since 2022, 37 work group meetings with our members. It's chaired by Walmart and Qualcomm. Has many of our members, and as you said, many HR and benefits people We didn't know. I come from HR and benefits, what a doula was. And so, I mean, it's been a learning journey, and we've really created this space where we're like really trying to understand what's going on. And we created, as a work group, we defined what it is we want to buy on behalf of our workers and family members. We identified measures for how we're going to know if we got it. And then we created contracting standards that have actions for both employers and health plans to take to be able to, really implement the kind of standards that we're seeing. And we had a multi-stakeholder input. And so I won't get into it, but it's a 35-page document. It's on our website. You're welcome to it. But our members are starting to work with their health plans, or if they have a direct contract, to say, these are the things that we want implemented on behalf of our workforce. And so I will say, we're starting that implementation. We're seeing some progress. But the number one item that they wanted to add was coverage for doulas. Mm-hmm. And so that, we can talk about it. That's a really difficult journey. And we could use your help, hospitals and health plans. We can talk more about that later, but yeah.
Yes. It can be. I do know hospital systems. There's a hospital system in Lubbock, Texas, a very rural area of Texas, has had a doula program for 15 years before it was popular, before anybody was telling them they should do it, because they wanted to make sure they had a piece of the market share that was, seeming to not come to them. And by starting that program at this point, 15 years in, their C-section rates are down. They're lower than anyone else. People are traveling to come to them. And now everybody around them who didn't start with them, they're trying to figure it out. And so what they said was, it's really simple. If there are doulas in your community, you make the connections to them. Mm-hmm. You put it on your website that you can request a doula. They have 11 doulas that they can work with and they partner with. They don't employ them. They're subcontractors to that hospital. It is zero cost to the patients that come in that hospital. It is a part of the bundle of care that they get. And the hospital pays the doula. So it doesn't necessarily have to be a policy. You don't have to have a state legislator tell you can do it. You don't necessarily have to have a health plan that tells you can do it. It would be great if you did. It would help so much and so many more people could have it. But the hospitals can also create this as a part of their services. And that changes the game for your area, because then people understand that they can come to you, they can get the support they need holistically, and that they don't have to go and figure everything out on their own.
So I think we've set the stage about the crucial impact and positive impact doulas can have on maternal and infant outcomes, as well as in addressing inequities. But let's share some tangible, what are the things that doulas are actually doing that do lead to these better outcomes? Anybody care to elaborate? When the doula is involved, they're advocating, they're informing, how does that then result in better outcomes? What's that interaction like in the actual birthing room?
I'll add some, and then Neil, I'm sure, can, and everybody else can add some too as well. But it's that physiologic humility. It's also, in other words, getting people out of bed. We need more intermittent auscultation so that then if someone is stuck in a bed, we know that they don't have freedom of movement, and so expanding our view of birthing in general. And so they bring that perspective. And the other piece is, and I know we're also we're talking about doulas, but I want to highlight the importance of midwives. To Neil's earlier point, is we have a backward system with, so if the mindset is that something's going to go wrong and we need to operate, and the person's main tool is operation versus getting them out of bed or supporting them or helping them not go to the hospital too early, then you're going to have a very different skill set. One is more supportive, the other is important when needed, but shouldn't be from the very beginning, like, when do I need to operate on you? Yeah, so.
Yeah, I mean, I have one systems perspective here, which is there's a lot of reasons why this conversation on doulas is relatively new, even though we have a half century of practice, experience, and evidence around it. One of those reasons is that Medicare doesn't pay for maternity. And so there's not like an 800-pound gorilla. CMMI, until relatively recently, has not really focused on this area, although there will be a program coming out of CMMI that'll be funded for the next 10 years, and I expect that supporting doulas at the hospital level will be part of that. But the point here is that there's not a lot of like payer leadership on this, particularly on the public side. And so in maternity, we've always been dependent on innovation coming from less expected places. And thank you, Randa, for your leadership on this. But I think purchaser attention here has made a lot of difference. And Maven works with purchasers. There are a lot of different kinds of purchasers. But just to give you one example, Amazon is a client of ours. Amazon has a baby every 18 minutes. They have a lot of purchasing power, particularly in certain markets. And they can see the Black maternal mortality crisis in their own claims data. 80% of their workers are fulfillment workers. 20% are technology workers. And they're very, very interested in supporting doulas. The challenge is that, as Lee and I originally started to discuss, like the infrastructure is not there. There's not the clear reimbursement pathway. There's not a clear credentialing system. There are 1,000 different certifying organizations. There's a lot of supply-demand mismatch. And there's a lot of lack of clarity around the scope of what they do, to get back to your original point, Ellen. But I think that fundamentally, like, why would you run a marathon without people like cheering for you? Like being prepared for labor and having people support, encourage, and coach you along the way, of course that's gonna make a difference around the hard outcomes like NICU rates and C-section rates, but also on the margin, because people deserve more than just emerging from the process unscathed, right? They deserve to be like empowered, ideally, as well, and that is essentially what they do. But the biggest challenge in healthcare, and why it's gonna take progressive hospitals like the one Latasha mentioned, and purchasers and all of us, is that in healthcare, you can do something that's very valuable for people, but still struggle to make money doing it. The demand for doulas is very clear. And I think that's where a lot of the purchaser energy is coming from. It's bottoms up from employees who want this as well.
You mentioned credentialing, lots of variation, complexity on the payer side. What are some of the other barriers to adoption, acceptance in the birthing room, acceptance among other clinicians, and willingness to partner with a doula? What else would you cite are some of the challenges and friction points?
I think that the healthcare system has been a certain way, and change is hard. So having a person in a space who might give information or ask questions to make sure that the patient, the client, got all of that and understood and understands what's going to happen doesn't make this faster. It means that now I have to explain it again, and now there might be a challenge to what I'm saying needs to happen here. And it doesn't have to be that. I think of this advocacy piece that gets a bad rap for doulas. I think it is thought about in terms of a barrier, a rejection, but it's really just thinking about what a person needs to make a decision, and then what happens after that decision is made. A person walking into a space and telling someone what they should be doing when they came in the hospital healthy, their baby came in healthy, and all of a sudden they need to be in a bed hooked up to things, there's something wrong with that. And so having a doula in a space that says, the reason why you're crying in pain is because that blanket that's folded over your lap and you're sitting in that bed means that you're not moving. You need to get out of this bed, we need to move, and here's how you can move to help you, to make this go faster, to get up. Well, now, this process of hooking them up is different. And I wanted to hook them up so I can go back out of this room and look at this monitor. And everything stay where it was. But advocacy is making sure that we think about what I call the benefits, the risk, the alternatives, and also what happens if we don't do this now or not at all. Giving people that information is advocacy. They need that to be able to help make and partner with healthcare professionals on their experiences and what's going to happen next.
Any other thoughts on that?
Yeah, I'll just add, if you've ever been in a healthcare system setting out of your comfort zone, right? Your brain isn't quite functioning, and especially if you've I like the marathon analogy. If you're really working hard or you're doing a workout, like having somebody watching and seeing where they can support and jump in is very critical. I think that the tension with the teams is that the teams are exhausted in so many levels, and I think the pandemic only added to that, and there's staffing challenges. And so I think there are ways in which the care team might need some doula support too. We all need to support each other. There's a lot of, but I think there is ways in which we as care providers can get support with each other and for each other and be in that together in a way that can be empowering for everybody, and not be fighting over who's the best coach, but how do we all work together as a team. And that takes a culture shift. That's that culture shift I was talking about, where whoever you need on your team to help that person have the best outcome, that's the approach we need to take.
Neil, and you're an OBGYN. You also are Chief Medical Officer at Maven. So how do you think most of your peers, OBGYNs, view doulas? Are they becoming more accepting, willing to embrace and partner? What's kind of that cultural evolution been?
I mean, I think it depends, right? I mean, I think that there's something that's sort of intrinsically adversarial about the idea that the patient needs an advocate and they're positioned between the clinician and the patient. Ideally, it's not that way. I do think there's a lot more acceptance. But I think, one of the biggest structural barriers to implementing doulas is one, like the unit economics of running a hospital are really tough. Like, do not need to tell this audience that. Like, it's really, really difficult to run a hospital in 2024 in America. And then doulas are like yet another thing. They're uncredentialed, meaning that there's not a mechanism to pay systematically. And I think that we're also putting a lot on everyone, but doulas in particular. I stand by my statement that paying for doulas is one of the most impactful things we could do for maternal health in the United States. I also don't think that a human being is a silver bullet, because a bad system will beat a good person every time. And one of the things that I'm spending a lot of time thinking about as the chief medical officer of a technology company is how to effectively productize a lot of what doulas do. I mean, you can't deliver a baby through a screen. So an app isn't going to fix maternal health or any part of healthcare. At the same time, nobody goes to Lamaze anymore. Most people who are birthing age, their primary source of healthcare information is TikTok. And there's an opportunity to create trustworthy alternatives to make sure that people are showing up prepared. And we've published multiple papers on this, but we have one in press right now. And it's very, very clear that, first of all, doulas and the kinds of services, if you were to decompose them, that doulas provide are most important for the people who are the most marginalized by the system. The impact of doulas on birth outcomes, for example, for our Black membership is almost double what the impact is for everyone else, but that's also because of the systemic and structural racism that exists and the disparity that was there in the first place. At the same time, the places where people would benefit the most from doulas are also the places that have the biggest barriers to standing them up in the first place, the most underfunded hospitals, and that kind of thing. So I think, I guess that this is my expression of empathy for the challenge of running a hospital, combined with the fact that I don't think that we can hang the entire thing on doulas or hospital leadership, and we have to start figuring out how can we take the services that doulas are providing and also take some of that and move it to other places, and ideally not TikTok, in my opinion.
Do you all have any thoughts on how to scale effectively what doulas do, whether it be through technology or other types of arrangements? I know your business is growing. You've got a lot of interest.
Definitely. So there are times when telehealth is very helpful. So some of the prenatal could be done through a telehealth kind of mechanism, and then maybe even some of the postpartum. But being in the space during the labor, I don't think there's anything that can fulfill that without a person being there, because that you have to see the room. You have to read the room. You have to see what's happening in the space and help to make sure that what this person actually wanted is happening. And you can't do that from a screen. I've tried to do virtual. I don't like that as much because it's hard to be heard in a space when you're on the screen saying, hey, did you ask? Hey, and then at some point people give up. So I think that, you know, prenatally, postpartum definitely can be done more. But in the labor, I think you do need a human there.
Yeah, I'd like to add that I think the telehealth is really helpful. We have a member who just implemented virtual doulas, and they're really excited about that. I would also just implore our health plan friends to help purchasers scale doulas, because one of the challenges around doulas, there are tax issues, so there are a host of issues on the employer side for this coverage. And there's great debate around the IRS tax rules around whether that's considered a healthcare benefit because it's not a provider versus a taxable benefit. That's a separate issue. I think it's obviously a healthcare benefit, my opinion. But I think that one of the challenges is that employers are faced with building their own network of doula providers because the health plans, because of the credentialing, because of the accreditation, the health plans have not created networks of doulas. And so it's incumbent upon each employer to kind of solve and curate their own network, which is very difficult for them to do. And so we have not gotten a lot of health plans to take us up on the request to create a national network of doulas. But if anyone wants to talk to me or Ellen after this, we'd be happy to talk to you.
All right, I've got another question I'm going to tee up for the panel, but I also want to give you all a heads up. We're going to be coming out to you for questions, and we'll have mic runners in the audience. So start thinking about your questions, and if you have one, raise your hand, and the runners will bring a mic to you. But a question I did want to ask you all, it's a little bit of a downer, but not all pregnancies are successful, and many times there are pregnancy losses. And doulas also play a crucial role in those scenarios. So would you like to share, any of you, how the doulas do support in those sad situations?
I'll just chime in because I know Leah came to our maternity summit, and I think this was something that along our journey as we were writing these contracting standards, some of our members came to us and said, we're only talking about successful pregnancies, and we've omitted the huge amount of birthing people that have pregnancy loss. And so I would just say I think that this is part of how doulas can support people during pregnancy loss. We know there are mental health and grieving processes that are required. And in fact, many of our members are changing their leave policies as a result of these in-depth conversations. And quite frankly, many of our members have experienced these losses. And so anybody that attended our maternity summit, you have HR executives and patient stories saying, this is what happened to me, and I had to go back to work 3 days later. Mm-hmm. And so I think that's another part of this conversation, and I think I would also say we think there should be safety measures for pregnancy loss under 20 weeks, and we have advocated for severe obstetric complication measures under 20 weeks because when you look at, I guess I'd say the current political environment that we find ourselves in, how do we look at that data and see what's happening for people that do not have a successful pregnancy?
Any other?
And I'll say it definitely depends on when it happens, earlier versus later, and how that process works. But in a earlier loss, you are oftentimes helping people as they wait to see, when this baby will come and how this will be, and talking through the process and making sure they have support, mental health, talking about their feelings, a lot of times what their what their dreams and hopes were for that pregnancy and this baby, and waiting until it happens, and then being there to support them when it actually does and after. So that's early. When it happens unexpectedly and the baby has gotten a little further along. There's, that processing time that people have had in the beginning where you kind of work through some of it before it happens doesn't happen. So it is a immediate shock to a person and their family. Oftentimes you're hearing about things that were said that didn't need to be said. You're hearing about things that were done that didn't need to be done, helping preserve memories, helping to make sure people think about the supports that they're gonna need if it happens. Everything that a person needs after having a baby that is alive, they need after having a baby that did not survive. You need time away from work. You need people to cook for you. You need people to bring you supplies. You need to make sure they check in on you. You need mental health support. You need all of those things. And it's not over after 2 or 3 days. It's not over after a few weeks. Those memories will continue to come back. And those experiences and the grief process is still very long. And so doulas are there to check in and to make sure people are doing what they need to heal and to take care of themselves for the long haul until they say, I think I got it from here.
I think that there's, what both Randa and Latasha sort of spoke to is that there's a need for a more comprehensive set of support around people. But, I have this take that the hardships that come with starting a family are something that everybody sort of normalizes because we just sort of do it. It's like, our childcare system is the same way. Like everyone just sort of scrambles and figures it out. And then somehow we lose empathy for each other. Like we don't build systems around these things. But pregnancy loss is incredibly common. It's like 1 in 4 pregnancies. Almost everybody who has children also had losses. Almost everybody, it's that common. And of course it impacts productivity at work. And of course it in fact impacts absenteeism. And of course it impacts people's well-being physically and mentally. But fundamentally, hospitals are not always well positioned to provide those comprehensive services because you come with a loss and the loss happens and then you leave the hospital and you're sort of on your way or you leave the clinic. So it really is going to require an ecosystem approach. And frankly, I think that people who are in this phase of life where they're starting and building their families have not been well attended to broadly. And I think a big part of the political moment that we're living in right now is a reflection of that. People feel that they don't have the same degree of opportunity and support that they did a generation ago. And it's empirically true when you look at the affordability and the safety of starting a family in America right now.
Thank you. I think it was important that you double-clicked on the emotional aspect, the mental health components. We talk about outcomes largely from a physical, outcomes perspective, but mental health has a direct correlation on physical health and supporting birthing people through all phases and the good and the bad of that experience is crucially important and the valuable role that doulas play in doing so. So thank you for illuminating that. All right, we want to come to you all now for any questions. Anybody have a question, please feel free to stand up. I see a hand right here. Go ahead. The mic is on its way to you.
Patient advocacy is clearly, important, and what y'all are doing is very important. What my question is, and y'all have brought this up, there is no standard curriculum, and if we're going to try to get this reimbursed, you're going to need that. What are you all doing to try to work towards that? Because without that, you get one doula that's amazing and another doula that's completely come up with some wacky ideas. So how do we deal with that?
I'll start by saying that also happens with doctors. Okay, all right, we're back. We're back. And so I think it is important to keep doing things like this and talking about doulas and making sure that people hear some of the story, hear some of what is actually possible, hearing the stats. I speak with, I live in North Carolina, so I speak at my state legislature all the time. I work with Health and Human Services around getting the word out and making sure people see a doula before they talk about a doula. And I make sure that I'm co-chair of the National Network of Perinatal Quality Collaboratives, so I work with hospitals across the country, and we're gonna have different sessions coming up on doulas to make sure that the state level supports for hospitals are also talking about it to their hospitals and helping them to language it and helping them to explain it to the people in the hospitals, because that's where we need them. It's great to partner with them on projects. It's great to put them in research, but we need them in the hospitals.
And just to build on that, I mean, I think we're about 5 years out from maybe having the kind of infrastructure that we might need, thanks to Latasha's work with NNPQC and other things like that. But on the Maven side, we're installing the same quality assurance systems that you would have for any other health professional. So there are 1,000 different certifying organizations. We credential doulas on our platform that have a subset of those, including donas, but not only donas. And then we have a community advisory board who weighs in on the credentialing process and is actually part of the credentialing committee, because doulas by definition are meant to be of the community. We review appointments like you would for a doctor, and we hold people accountable to performance standards. The number of purchasers and health plans who've asked us to carve out and or stand up national networks, like I mean, it's that within the last year.
Yeah.
And so we've been like deep into the complexity of this. And you know, I don't think this is something that you can, as much as people may want to, like turn on overnight. I think it is going to take a minimum of 5 years to be able to do this. But in the meantime, whatever it is we are doing, it's really important to do responsibly so that we don't have regression on the progress that we've made. And I know that you know, hospitals are held very accountable, clearly, in this room for safety and quality. And so it's important that we use those same systems as we bring doulas into the system as well.
And I do welcome the question, because it also brings up the point around having ways to monitor the quality of the care given by doulas, as well as the entire team. So I see the doula as part of that team, and then the outcome. And I think we are going to need to have data to track, and also our doulas being equitably utilized. In other words, are doulas, you know, a premier service versus like everyone access service, to make it accessible to all hospitals, all communities, all areas, and not just the privileged few. And so I think that's part of the data that we need to start tracking around the benefits. I also think it's been hard to tease out the benefits of doulas compared to midwives. If we look at the data, the results of the research studies are pretty clear that there is, because they often have worked very closely together. And so in some of the research studies, it's clear that there is some challenges in teasing out which are the benefits from the doula, but there are specific care practices that an international guidelines childbirth initiative around what every birthing person should be able to expect in a system. And I think, you know, like this will take time to sort all of that out, but what is it that doula will need, what are we holding them accountable for doing? And then how does that fit with the rest of the team? And that's why we're having this conversation today, is because we need to have these conversations and work that out.
Right. I see a hand up over here, and if you're on this side of the room, I might not see you, so just shout out or raise your hand so a mic can be brought to you.
Joe Mazzola, Chief Medical Officer from Iredell in North Carolina. Thank you for the conversation. My twist is a little different. We talk about the hospital as an entity, but the hospital is made up of medical staff. And so although, you know, our hospital is receptive to doulas and we have doulas occasionally, how do you engage the physicians, maybe Dr. Shaw or the other group, to really embrace the doula and bring them as part of the care team? Because I can be open to it, I can work with my nursing staff, and we can be open to having doulas as part of our team. But if my physician partners, who I don't employ them, they're independent, how do they get involved? How do we get them involved to be open to the idea of incorporating doulas more in that maternal health? Because we can do the prepartum, as you mentioned, you know, I'm an old family doc, I've delivered babies, Lamaze, Bradley, been down that path. But, you know, if the obstetricians are not interested or open, how do I bridge that gap?
I'm sure Latasha has a really important take here too. I mean, part of my perspective is that it's not just physicians, it's largely labor and delivery nurses as well.
Right.
But 80% of the cost of running an L&D unit is the nursing staff. And you all know very well there's large amounts of attrition out of the workforce. There's a lot of pressure on on those clinicians. And I think anything that's net new, whether it's doulas or a new safety or quality improvement initiative, it's got to make the lives better for the people that are on the ground. It's got to make things easier, and everyone is there in service of the patient. But the truth is, most nurses today, they're not in the labor and delivery room. They're not at the bedside, right? Because they're running around crazily. And so the idea of having someone else there to be helpful could be really appealing. And when I've seen this work really well, that is the relationship. They truly see the doula as part of the care team. That's value added and also making their own lives easier, as opposed to it being something that's adversarial or taking away or subtractive. But
I think that's key. I've seen hospitals who have a higher cesarean rate and who don't have, as many doulas come through, and I've seen ones who are used to having doulas come in. And for the ones who don't see doulas very often, I know I have to win them over. I know I have to show them that I can do things that they can't do. And after I do that, then it's golden. And we partner much better. We have conversations. Having the relationship with people before they enter the hospital and being able to point out things that this nurse may not know, that this doctor may not know about this person is beneficial. Helping them to understand how to move and when to move strategically in a birth is something, and the positioning is something that a lot of times the doctors and the nurses don't have. They don't have that information. Being able to get someone to do things that no one else can is beneficial, right? And so once I walk into those hospitals and they start to know my name, they have notes. I know they take notes because they know me. They know too many things about me at some point in their labor. And so they start to, note like, oh, thank you for that. This was very helpful. And in those scenarios, you build this culture that says, oh, this is how doulas can help us to actually do what we want to do. We want to see them have the best possible care, to get the information and feel supported and not have to have cesareans that are not needed. Or, we want to see that. And so when they start to see that benefit, they're easily won over, but they don't have the experience and they haven't been around doulas. I think it's difficult. So I think it's important to bring them in.
I think we've got time for one more question, if there's another question out there.
While we're waiting, I'll just add, I know from change theory research, get a champion among the group that you want to most influence. So you want to influence the nurses, you need a champion that is a nurse. You want to influence the doctors, you need a champion that's a doctor. And so then they will be the ones that help make and smooth the path. And that's very research-driven approach to change.
Yeah, and I think I would just add that, doulas are not providers by definition. They do not provide care. And when you think about from an employer perspective, they are defining, back to your question, and as a follow-up, they're providing, some of our members think about it as community health workers, navigators, patient advocates, things like that. And they do much more than that. But I just want to think, for those of you that work with caregivers as well, I think that's how people, or at least employers, are thinking about it as more of support. When we think about the erosion of and medical mistrust, it helps brings trust and can be a great partner for the clinical team to have a trusted advisor who knows what to expect and can work with the patient. So that's the way we think about it.
Was there another question?
Right here.
Okay, where I can't see you, but I think there's a question over on this side, so go ahead.
My apologies, I needed to stretch.
Good for you.
I just wanted to know, since COVID, they've limited the number of people that they want in the room for deliveries, et cetera, et cetera. So are the doulas truly considered part of the care team, or do you guys find that they start limiting, you can't bring your partner if you're bringing the doula into the room, that sort of thing?
I think it varies. There are hospitals who will have the partner and another person. So now you're choosing between grandma and doula. And then there are some who say the doula is a part of the medical team. You still have two people that can come. It varies on the policy at each hospital. And sometimes we have to continually check because it changes still, even after COVID.
We recently ran an experiment. So there was about a year and a half where a lot of hospitals had severe visitor restrictions and families had to choose between there being a partner, sometimes nobody, or a doula. And then many doulas started to experiment with virtual services just like other clinicians did. But nobody had ever studied virtual provision of doula services before. There's 2 Cochrane reviews on in-person doula services. There was nothing on virtual doulas. So we looked at our data because we have a lot of scale. And we actually published this in the Green Journal, which is the highest impact journal in OBGYN. And I fully agree with Latasha, like there's no substitute for being in person. Also though, by the data, the impact on cesarean rates was at parity with in-person services because providing care and support compared to not providing care and support is better. We're not splitting the atom. And the impact was greatest for people who were VBAC candidates and Black. There was a very distinct difference in the confidence interval in terms of the amount of impact, but very reliably you see lower cesarean rates even with virtual services. Not a substitute, but still potentially very valuable.
All right, well, Neil, Latasha, Randa, Deborah, thank you all so much for sharing your expertise. Everybody, please give them a round of applause.